Today I'm going to be discussing a behaviour modification technique known as habit reversal therapy. Many young children have habit behaviours. They're generally considered socially acceptable and usually quite harmless. But in some cases, the behaviour can persist beyond a certain age, or perhaps they attract negative social attention, and so they might require professional help to rectify the problem. Some examples of habits for young children include hair twirling, thumb sucking, um, nail picking, that sort of thing. If we take one of the examples of thumb sucking, this is an automatic behaviour, often develops in early infancy, and children often use it as a method of self-soothing. Um, it's only when it persists beyond around the age of 4 that it can present a problem for children. The problems that can generally arise from this include overbite or dental problems, chronic mouth breathing that can lead to recurrent illnesses, and criticism from peers or teachers, and then obviously the added issues of cleanliness and germs, etc. To help stop this habit behaviour, there is a proven 4-step method that can be used, and I'll explain this for you now. The 4 steps are awareness training, competing response training, social support, and motivational training. But before you can actually start doing this, you need to really find out what's going on so that you can really identify what it is that you need to change. This is generally termed a functional assessment, and it's important to do this in the beginning so you can really clearly identify the behaviour that needs modifying and really find out when it occurs, how it occurs, is there anyone else around when it occurs, and really get a good idea of how you can intervene and help in this situation. The first step is awareness training. Once you've done your functional assessment and you know what you're dealing with, awareness training is especially helpful with habit behaviours because in the case of thumb sucking, it is an automatic behaviour, and most of the time the child's not even really aware that they're doing it. It's just such an automatic behaviour. And so you would discuss with the child exactly when it happens and what they're doing when it happens, and really try and make them aware of the times when they are doing it. There are a couple of methods that have been used to assist with awareness training. One of these includes putting a lightweight weight around the wrist of the child, of the hand that they suck. This is going to increase the perceived effort that's required to lift the hand or the thumb to the mouth in order to start sucking. It's generally been found that increased awareness can actually reduce a large proportion of the behaviour just because you're more aware of it. If they were self-recording that behaviour, all these methods do tend to help make the person more aware of the behaviour and reduce the amount that they're doing it. The next step is competing response. This is generally a behaviour that you teach the person that's incompatible with the behaviour that you're trying to get rid of. So in the case of thumb sucking, you might ask the person to, every time they either think about sucking their thumb or consider or find themselves sucking their thumb, that they would do something else instead. Basically replace that behaviour with something else. So an example that I've used in the past with a client would be for the person to put their thumb inside their fist and clench it tightly for 1 to 3 minutes every time they feel that urge or notice themselves doing it. Another one could be to sit on their hands. Another one could be to lay their hands in their lap every time they think of it. So you introduce these other behaviours that can replace the target behaviour that you want to get rid of. And this brings us to social support, which is really important at this stage. especially with children. It's important to give them some support in that. So initially it might be a prompt to remind them that they need to be using these new hand movements. And once that's in place, the second part can be to actually praise them when you notice that they are using these new hand movements. So with all of these things going on, it brings us to the final point, which I think is also really important, which is the motivational training. As human nature tells us, we prefer to have something or a reason why we're working towards something, some kind of goal or a reward. And children are no different in this situation. I would recommend that you set up a schedule of rewards, perhaps starting at day 1, then day 3, and day 7, and then weekly after that. This gives the child something to work towards. Their rewards are spaced closely together in the beginning, and this gives them instant feedback and reward for their changing and their efforts. And then slowly spread them out over time so that they have to wait a little bit longer each time, but they're persevering with the behaviour. Generally, this should only take 3 or 4 weeks of rewards to really try and get a hold of that. The only other final thing I would suggest is that you follow up with the person maybe 3 and 6 months after the intervention, just to see if they've been able to maintain the change in behaviour. So there we have it. They are the 4 steps in habit reversal therapy. You might be able to try this yourself with somebody you know, and thanks for listening.